Hi everyone, I am Dr. Freddie Gomez, and you're watching The Doctor is In. And as always, we hope to answer your many questions and medical concerns about COVID 19. Our topic for today is your skin. We'll talk about skin conditions that might be associated or triggered by COVID 19. And in addition, we'll also discuss personal skincare and how to take care of your skin so that it looks its best. So, we're going to talk about a lot of topics and cover a lot of things. So, let's get this discussion going. Joining us on the show is Dr. Joyce Castillo. She's a board certified dermatologist and fellow at the Philippine Society of Venereologists. Hi, Dr. Joyce. We're glad you could join us
Hello, good
today.
afternoon.
Great. So, we're hearing a lot of reports about skin rashes that have been seen in some COVID 19 patients. Sometimes they're small red spots, similar to rashes seen dun sa mga may dengue, or large flat rashes. And in other cases, they're raised or even elevated lesions. Though rashes are not an official symptom of COVID 19, patients do experience them. Kasama to palagi minsan sa mga simptomas nila. Dr. Joyce, what do we know so far?
So, Freddie, there's a lot of reports that a certain percentage of COVID patients have rashes and they are polymorphic. They look different. They can be vesicles, they can be yung kamukha ng dengue, they can be flat, raised bumps like allergies, and then they can also be wheals. Iba-iba yung itsura. But it's only a small percentage, but they really report certain rashes that happens with COVID. So there's also COVID toes. It happens in mild cases of COVID. And then we are still really discovering a lot about COVID. There's really a lot that we don't know still.
Right. Oo, so that's true, no? Marami pa tayong hindi alam. So at least ngayon, merong bagong symptoms na ngayon, yung mga rash na to. So yung mga rashes, karaniwan ba, are they often, because a lot of our viewers will think pag may rashes, Makati ito. Is this a common case? Pag may, yung mga rashes na ganito, palagi ba siyang Makati?
Not all the time. Some of them makate, some of them are masakit, and some of them have you don't feel anything at all.
Okay, pero kung let's say other rashes or sorts, meron bang mga pwedeng oral or topical medications in order to relieve yung mga kate na ito? Because sometimes itong mga kate, ibang klaseng kate, no, it can be very frustrating, it can be very annoying as well. Ano bang pwedeng inumin or kaya ipahid para sa mga ganito?
So for rashes like this, symptomatic relief lang. We can give antihistaminics, pwedeng sedating, nakakaantok na antihistamine, pwedeng hindi nakakaantok na antihistamine, pwede din na topical treatment like antipyretics, anti-itch, like steroid lotion or steroid cream.
Okay, pero siyempre kailangan na ingatan natin na dito yung mga skin irritations as well because it's ang pinaka best talaga is not for the patient not to scratch those rashes but sometimes if someone scratches too much what happens is pwede pa nga itong maging sugat, hindi ho ba, Doc Joyce?
Yes, so magsusugat, tapos magiging infected na sugat. So more problems for us. So we should not scratch.
So that's right. So ang best pa rin is ipahid like the ones you mentioned, no? Yeah, there are some creams, some steroid creams as well para to minimize the itchiness in order for the person to not scratch. Now there's also been a thing about, you mentioned this earlier as well, pero COVID toes. So this is a symptom na nakikita sa toes na associated, nakikita nila madalas doon sa mga infected with COVID.
Yes.
What do we know about this so far? Is this common or how can How can we spot this?
Okay, so far, it's not very common, but it's reported in young adults and children. But the COVID cases of these patients are mild, and then they happen when the patient is about to recover. And yes, it's not very common.
Okay, but
So they appear like
I'm not sure if
I
it's a
think we have
good
a
thing that
picture.
it's not so common.
So the picture shows
Yes, I
there
think
resemble
they will
frostbite
be able to
actually.
show. Okay, but do you have you ever seen a case of COVID toes here in the Philippines yet, Dr. Joyce?
Fortunately for me, I haven't seen any of these.
Okay, and do we also know if there's any pain or discomfort associated dito sa COVID toes?
So they are reporting sometimes throbbing pain, sometimes itch, so makate, and then may konting sakit, may konting pain, and then some of them don't feel anything at all.
Okay. And as we mentioned, rashes are not listed as a symptom of the coronavirus, but we want to remind our viewers about the symptoms of COVID-19 that we should all be aware of. They're worth reviewing and at the same time understanding how doctors are treating the symptoms of COVID-19. So, some of the most common symptoms, again, ulitin lang natin, Doc Joyce, para sa mga viewers for COVID-19 are the fever, the dry cough, and yung weakness or tiredness na nararamdaman nila. So if ever any of our viewers might feel this or are in doubt of this, please do have a checkup with a doctor with a doctor as well. Ngayon,
Tama.
what we want to ask now is for you to help us, Doc Joyce, answer some of these questions that we have from our audience. So, you've heard this a million times already, pero uulitin pa rin natin, ano? Good personal hygiene is your best defense against COVID-19. So, wash your hands frequently and thoroughly. And if you can't wash your hands and you're out and about, we highly recommend using hand sanitizers with at least 70% isopropyl alcohol. Okay, all right. So let's go ahead and read a couple of our questions from our social media audience. We have one from Ann Valdez. Ang tanong ni Ann, I have blisters on my skin. Can I wash it with soap and water? Natatakot po kasi ako na baka mas lalong ma-irritate. What do you think, Joyce?
So the blisters are on your hands, or let's say the blisters are on your hands
Just
from too much washing. Yes, you can wash the blisters with soap and water.
the
The usual
question was,
hygiene.
sorry, Dr. Joyce, the question was, meron lang siyang blister sa skin. And can she wash it with soap and water? Can she wash a blister with soap and water? Kasi natatakot siya na baka mas lalong ma-irritate.
So generally, blisters on the skin have to be cleansed with soap and water. It depends lang where the blisters are. No, I hope they're not on the very sensitive areas. But if they're on the hands, she can wash it with soap and water. And then it's very important to apply a moisturizer after.
Okay, very good. We have another question. Ito naman is from Henry Fortuno. Ang tanong niya is it okay to scratch the itchy part of the rashes? So we discussed this a little bit earlier, no? But we want to talk about this again for Henry. So what do you think, Doc Joyce? How should Henry manage yung makakating rashes niya? Kakamutin ba niya o hindi?
Freddie, it's never okay to scratch itchy parts of your skin because you make it worse. You make the problem worse, and then you make some microorganisms have the chance to enter your skin. So we can relieve the itch by applying antipyretic creams, and then just make sure not to scratch it.
Okay, so Henry, narinig mo na kay Doc Joyce. Now, wearing masks is highly encouraged and recommended these days, but some people are breaking out from wearing them. Coming up after the break, we'll talk about how to treat mask acne or maskne. Also, personal skincare in this time of the coronavirus. You're watching CNN Philippines. We'll be right back. I'm Dr. Freddie Gomez, and welcome back. Our topic for today is your skin. Wearing a mask is now part of our day to day, but there are some people who end up getting mask acne, and we want to help address this condition. Let's discuss this with Dr. Joyce Castillo. Now, healthcare professionals who wear masks often are among those who have to deal with maskne. Also, people who wear helmets from riding bikes and motorcycles have also experienced this. But with many of us wearing masks these days, some are now experiencing mask acne. So, Doc Joyce, could you please tell us what causes mask knee or mask acne?
So it's a combination of factors. Syempre, mainit, no? So we're sweating. And then we have increased sebum production. There's more oil in the skin. And then, so because of the maceration and the humidity, pumapasok yung bacteria. And then our skin gets irritated. So our skin forms acne and some small bumps, like an acneiform reaction. Parang acneiform reaction. It's very common. I have
Okay,
it.
but okay, that's unfortunate that you have it right now, Dr. Joyce. I guess that's the best time for you to be able to describe to us that experience of having maskne or mask acne. Ngayon, Doc Joyce, there are some parts of a mask, maraming mga iba't ibang brands ng mga mask dyan, iba't ibang material. Could these variations in mask material be a cause of mask acne? Mask acne?
Oh, yes. The best would be to wear soft cloth masks for those with very sensitive skin. But for us who have no choice but to wear medical masks or those N95 masks, we have to bear it. But it's really best to wear the soft cloth masks. That's really non-sensitizing for the skin.
Okay, yeah, yes, that's very good advice. And also, like what you mentioned, yung mga masks na higher grade or even respirators and stuff are reserved for those health professionals such as yourself because you're exposed to this more often. But for the everyday person, the one who goes to work, a cloth mask is okay because what you're trying to do is containing the virus. You're trying not to spread it. So a cloth mask, a soft cloth mask is actually okay. Pero Doc Joyce, ang pinaka mainam na tanong is how can someone avoid having mask knee? Or if someone who has it just like yourself, what's the best way to treat it as well? Let's start with how to avoid it muna.
Okay, so you change your mask often. I advise it to be changed really twice a day. And then when you sweat a lot, you have to remove your mask for a bit if you have the chance to, and then make some way to wipe off the sweating. And then to treat it, I recommend anything that contains salicylic acid or benzoyl peroxide or a benzoyl peroxide combined with clindamycin.
Okay, so that's a something that will dry the skin and as well as an antibiotic for the skin, in order to treat it. But best advice is if you have mask acne or mask knee, best is to see a dermatologist, para wala nang second guessing. Don't try things on your skin. Don't put things on your skin that you're not sure of. The best way talaga is to visit your dermatologist for proper guidance and treatment. So, with or without mask acne, it's important that we always wear a clean mask, as what Doc Joyce mentioned. So, disposable masks should not be reused. For cloth masks naman, here are some tips on what types of fabric works best. Let's watch this. Okay, so that video shows just how important it is to have a clean mask at all times. So at least, according to Dr. Joyce, change your mask twice a day. So a cloth mask is okay na, good enough. So wearing a mask can definitely protect you from COVID-19, but more importantly, just in case you have the coronavirus or any respiratory infection, that mask can protect others around you from getting sick. Now let's talk about personal skincare naman and how to keep someone's skin at its optimum best so that they look their best as well. I know there are some of you, many of you out there who would like to return to their skin clinics for a facial perhaps or other treatments that are available. Well, what's the situation with that and what safety measures should people look out for? What do you think, Dr. Joyce, for those who are looking for that skin treatment that they've been missing for the past 2 3 months, how should they approach this if they want to be safe from COVID-19?
Okay, a lot of dermatologists now are doing telemedicine. So you will still get the same professional care, just in a very safe environment in your homes. So I still encourage people to stay at home unless you really need to go to a hospital or you really need to see your doctor. So we can advise you from afar.
Okay, that's very good advice. So, using telemedicine or technology available, and while they're at home, they can also still have that skincare routine, or that is very important. From washing your face to moisturizing to using sunscreen, even to protect yourself from harmful UV rays. So, I'd like to thank you very much, Dr. Joyce Castillo, for your tips and advice. We appreciate your generous time. Maraming maraming salamat.
Thank you for having me.
Okay, and we're monitoring your questions here on Facebook and we'll try to answer them later. So please keep them coming. You're watching The Doctor is In. And when we return, more about skin conditions associated with COVID 19. And during these uncertain times, there are also skin problems that could be triggered by stress. Stay with us right here on CNN Philippines. Hello and we're glad you could join us today. I'm Dr. Freddie Gomez and ang topic natin ngayon is some possible skin manifestations of COVID-19. Our guest for today is Dr. Sharon Lim. She is a board certified dermatologist and consultant at the Makati Medical Center. Show, Dr. Sharon.
Hi, good afternoon.
Now, earlier we were talking about rashes associated with COVID-19. And what we want to know this time is it also possible that rashes are associated with stress? Kasi alam naman natin ngayon, maraming ang nasa-stress with all the uncertainty that is going about. Pwede bang magkaroon ng or mag-manifest ang rashes, Doc Sharon, in regards to stress?
Yes, it's very possible. Usually, patients present with what you call urticaria because of just the anxiety of not knowing or the anxiety of having COVID. And of course, with these times, COVID is so unpredictable. We don't know too much about it. So, of course, anxiety and stress is part of it, and it can definitely cause rashes.
Yes, that's true. So at least to minimize or to manage that stress will hopefully alleviate those symptoms such as rashes. Now, hand washing is also important to stop the spread of COVID-19. But the frequent hand washing and use of alcohol or hand sanitizers can sometimes cause dry skin. Now, Dr. Sharon, what can you recommend? How can we keep our hands hydrated and avoid dry, cracked skin at the same time?
Okay, I'm glad you asked that question. The best thing actually is hand washing. A lot of people think that alcohol is much better than hand washing, but hand washing is much more thorough. You have a lot of water and soap, which is much more efficient actually at killing the bacteria. The alcohol has to be a high concentration, 60 to 70%, to kill bacteria. And you need at least 1 tablespoon of that on your hands every time you want to sanitize your hands. So imagine how drying that can be. So the best soap to use actually would be something that is mild, something doesn't have fragrance, and something that is not scented, and something that doesn't have a color. And then to moisturize after with a like moisturizer that doesn't have any scent or doesn't have any dye.
All right. So I guess the amount of this is you don't really need that much because uh, the habit of trying to apply a small amount of hand cream into your skin after washing your hands or after applying alcohol to avoid having dry skin should be a common practice by a lot of people, don't you think, doctor?
Yes, I totally agree with you. Moisturizing really is trying to maintain the barrier of the skin so that it will protect you from other harsh chemicals.
Okay, and at this time, basahin naman natin ang mga tanong ninyo sa Facebook. Whether associated ito sa skin conditions or meron kayong ibang tanong tungkol sa COVID-19, alamin natin yan. So here's a question from Olivia Ocampo. Ang sabi niya, aside from applying moisturizer, what are the natural ways to keep your skin hydrated? What do you think, doctor?
Well, I think using a mild soap. So, as I said earlier, something that's not too scented. Don't use a detergent because some people like to use bar soap or laundry detergent as a hand wash or a body wash. Don't do that because it's too harsh. Just use a mild soap that doesn't have any fragrance or mild fragrance, and something that is not dyed. Nothing like purple or green or blue. We like those things, but the best is really just something white, something plain and something simple.
On that note, doctor, what's a common sign that someone has washed their hands with not the appropriate soap, that it's already at that point of becoming dry and cracked? Is there an initial symptom of this? Will their hands feel itchy at first? Is there a burning sensation that their hands need extra care?
That's a very good question. The first sign really of irritation is tightness and dryness, and then starts your itchiness because not because you're allergic to anything, but most likely because you're irritated and your hand is dry. So you need just a plain moisturizer to bring back the barrier or to protect the barrier of your skin.
Okay, very good advice. Now ngayon, meron naman tayong tanong from Chris. Her question is, if an alcohol is mixed with moisturizer, can it still be an effective disinfectant?
It can, but you have to check the content or the percentage of alcohol. As I mentioned earlier, it has to be 60 to 70% for you to achieve that bactericidal effect. Sometimes, if you use a moisturizer or alcohol, it doesn't really mix, the formulation doesn't really mix well together. So, if you notice, if you put alcohol, you have to dry your hands first before you can put a cream because the two just don't mix well together.
So if you would give your suggestion, your personal suggestion, Dr. Sharon, to the viewers, if they're out and about and they're not at home, is it okay to carry that little alcohol sanitizer bottle, or should they just carry a bar of mild soap and try and look for a faucet nearby to wash their hands whenever needed?
Well, I think soap and water is really the best. But if there's no water or there's no clean source of water or not enough water, then alcohol is fine. Just make sure that you moisturize after and you should be okay.
Okay, very good advice. Unfortunately, we've come to the end of our show. Dr. Sharon Lim, thank you very much for joining us today on The Doctor is In. Your expertise and advice has definitely helped a lot of us.
Thank you for having me.
And as more restrictions are lifted and marami sa atin, we are out and about, going to work or running errands, let me remind you again, maintain social distancing, practice good personal hygiene, and stay home when you're not feeling well. Let's stop the spread of COVID-19. Thank you very much for watching. I'm Dr. Freddie Gomez.